Thank you, President Officer. And can I start by drawing the Chamber's attention to my register of interests, where it's listed that I'm a member of the Terence Higgins Trust, which is of course named after Terence Higgins, who was the first person to die of AIDS, succumbing to the disease in London St Thomas's Hospital, aged just 37. I'm very grateful to all the members who have decided to stay in the Chamber to listen or to participate in this debate designed to mark World AIDS Day tomorrow. I'm particularly grateful to HIV Scotland for all the work they have done ahead of tonight's debate and indeed ahead of tomorrow's lunchtime reception in Hema, which members are most welcome to attend. Having cornered several friends across the Chamber and encouraged them to speak tonight, I know we're in for an excellent debate. For Labour's part, Nath Sarwar will pick up the global and international development dimension of the battle against HIV and AIDS. Monica Lennon will discuss issues around HIV services for drug users, whilst Daniel Johnson will talk a little bit about Waverley Care here in Edinburgh and some of the work that Edinburgh University is doing to find a cure for the disease. That leaves me with plenty of scope to reflect on how we got here. I've had a long-standing interest in HIV/AIDS, an interest predating the experience of knowing dear friends who are HIV positive, an interest that predates being at ease with my own sexuality and understanding the history of the LGBT community's relationship with the disease, and an interest that predates all the fundraising efforts on our TV screens to tackle the spread of AIDS as it did and continues to savage sub-Saharan Africa. I am very much a child of the 1980s, born in 1981, the year that AIDS was first clinically observed. It wasn't called that at first. The working title, so to speak, was 4H, named after the 4 groups most likely to get it: heroin users, homosexuals, haemophiliacs, and Haitians. That was replaced with GRID, which stood for Gay-Related Immune Deficiency, a name which fortunately had a Mark Fowler try and tell his mum and dad in EastEnders that he had a virus, that it was just one of those things, that it didn't mean that he was ill, just that he could get ill. But all they could hear was AIDS, and all they could think of was the death sentence that came with it. What I didn't and couldn't appreciate, though, was how HIV/AIDS was affecting this dear city that I now have the great privilege to represent. Because, of course, we can't and shouldn't forget that Edinburgh was, during the 80s, the AIDS capital of Europe. And if Edinburgh was the capital, Muirhouse was the epicentre. A community with deep-rooted poverty, appalling houses, and mass unemployment was exploited by drugs, and the heroin brought HIV. A study of around 230 drug users from Muirhouse in the 1980s showed that 52% of them were HIV positive. 52%. Sharing needles was literally a game of Russian roulette, a game brought vividly to life for all of us who have seen Irvine Welsh's Trainspotting. Such a density of cases forced the Scottish AIDS Monitor into existence, and soon support services, which we now know as Waverley Care, were established. Milestone House was opened as a hospice for people dying of AIDS in 1991. And on Friday night, I attended a Waverley Care event to raise funds to keep it going 25 years on. The difference now, of course, is that it's evolved from caring for those who are dying to assisting so many more people to live their lives positively. In preparing for tonight's debate, I took some time out to look properly at some of the press cuttings from the 1980s. It's hard now to grasp the absolute outrage which was sparked when Princess Diana was photographed holding the hand of a man dying of AIDS in Canada. How brave and groundbreaking it was of her to say in 1986, HIV does not make people dangerous to know. You can shake their hands and give them a hug. Heaven knows they need it. She seemed to know instinctively that what was needed was compassion and understanding, not fear and ignorance. How applicable that is to so many of the problems that we face in the world today. The first debate on HIV/AIDS in the House of Commons took place in November 1986, serendipitously almost 30 years ago to this very day. Having read the full Hansard report, I'd like to share some of the excerpts with the Chamber. The Secretary of State for Social Services, Norman Fowler, was the first to speak. He told the Chamber that AIDS was a serious threat, that there were 565 cases in the United Kingdom and 284 people had died. He said, and I quote, "The likelihood is that it will be a problem for the next 10 years, probably for the rest of the century. Even if no one else becomes infected tomorrow, there are still an estimated 30,000 carriers." Little did he know that just 5 years later, there would be 10 million people living with HIV, a figure that stands today at 36.7 million people. Sir David Price MP rose to ask for some clarification from the Minister. Could the disease be transmitted through saliva or tears? What about breast milk? Was it safe to hug, to kiss, cry or shake hands before concluding, there is no evidence to treat them as lepers, although some elementary precautions should be taken? Anna McCurley, the Tory MP for Inverclyde no less, suggested that homosexual surgeons, dentists and even people working in the food handling industry should withdraw from their jobs and be compensated by the government for doing so to reduce the risk of transmission. My dear friend Gavin Strang, who served as the Labour MP from Edinburgh East for 40 years, was the first to demand specific help for prostitutes. Counselling, alternative work, free condoms, dedicated healthcare, just 4 of his demands, which he saw as necessary having watched the disease take hold of Edinburgh firsthand. Frank Dobson warned that the threat facing the heterosexual community was underplayed. He said that is partly because of the presentation of The Sun and other newspapers of AIDS as a gay plague. The people responsible for that sort of reporting, he said, must bear a great deal of the blame for helping heterosexuals to believe that AIDS was no threat to them. I could read from this all night, Presiding Officer, but I suspect you're keen for me to conclude at some point soon, not least to let other members have a go. Safe to say I'll tweet the link to the full debate so folk can read it for themselves. Fast forward 30 years to today, and we've made vast progress. HIV is now one of the most scrutinised viruses in the world. We probably know more about its transmission, its spread, management, treatment and prevention than any other. Yet we have no vaccine and no cure. But we're close. Medical advances have given us antiretroviral therapy, which has transformed the lives and life chances of people living with HIV. Testing is absolutely critical because early detection combined with early adoption of antiretroviral medication means happy, healthy lives. In fact, someone on antiretroviral meds can now have a viral load so low that the disease becomes undetectable again, and the risk of transmission to others so small as to be statistically unquantifiable. A HIV infection is no longer a death sentence. People living with HIV today say that it's not the infection that's the hardest thing to live with. It's the stigma, the fear of how people will treat them. Fear and ignorance, 2 concepts which were the drivers behind how this country spoke about and dealt with HIV and AIDS in the 1980s and which still exist today. But 2 concepts which we know can be defeated by education, whether that's formal education from schools to pupils or the information given to those working in saunas, or through informal conversation, compassion and understanding, and through nights like this and days like tomorrow. So in marking World AIDS Day this year, Presiding Officer, I conclude that whilst there is so much being done to tackle HIV, there's so much more to do. And I pay tribute to all those individuals in HIV Scotland, THT and Waverley Care who have made this their life's work. I move the motion. Thank you.